Welcome to Stem Cell Activators with Dr. Joseph Christiano. Dr. Joe is a naturopathic doctor with over 45 years of experience in natural health. Each show is about one of our 27 different stem cell activators, and today's show will be focusing on the activator for lungs. Listen and discover how stem cell activators are helping people enjoy a greater quality of life.
Hi, I'm Dr. Joe Christiano, and welcome to my show. I'm so glad you tuned in. You know, if you're somebody that's struggling with health issues, if you have anything like diabetes or peripheral nerve damage, or maybe conditions with your liver, kidneys, or like today's show, the lungs, then you came to the right show. And the reason why is because my shows are all about addressing conditions and going to the root cause. Look, if you're a patient, your doctor has probably given you multiple medications to take. And over time, those medications start to cause toxicity to build up in the body. But they have never been designed and formulated to heal you or to correct the condition. At best, they're going to only manage the symptoms. Well, our shows are going to show you by educating you and getting you to get a bird's eye view of the root cause and by addressing it. And I've done this study for years, and I've come up with what I think is one of the best alternatives in natural health that's very natural, that addresses the root cause, and they're called stem cell activators. Of course, that's what the shows are about, but stem cell activators are targeted. We have over 27 different stem cell activators for 27 different conditions. Like I said, today's show is about the lungs, but we have all these activators that will address each condition in all our shows. Think about this for a minute. If you were to only stay on medications or protocols of medication and did nothing more, like I said, the best you're doing is managing symptoms, and the root cause is going to get worse. It's like the scenario of your house is on fire, and the smoke is actually the warning or the symptom. Now, if the fire company came and sprayed only the smoke, your house is gone. Well, so is your health, so to speak. But when we can address the root cause with stem cell activators, now we're going to see the change. Now we're going to see the improvement. As a matter of fact, I have people all over the United States, parts of Canada, all over the world that are taking these stem cell activators. And let me tell you something. I'm getting some very, very powerful reports back. Some reports are near miraculous. Now, that's not the case for everybody, but when I see, after all these years of being in natural health, all the protocols and medications and programs people follow, I see them 15 years later and they're not getting better. If you're not getting better, if you're not improving, you're getting worse. And so these shows are all designed to educate you, to get you more informed so that you have better options or more options than the options you're following today. In our shows, we're going to do a real person, a real live testimonial that a person will share with you what they've gone through with their health. Listen, right now I want you to call my office. It's 1-800-259-2639, 1-800-259-2639, or go to my website, bodyredesigning.com, and make a decision today. If you call the office, my girls will do the best to answer any question you have, but don't put it off, because now's the time to improve your health. Now, I want to kind of get you to sit back a little bit and think of this scenario. It's very, very powerful. You're at the doctor's office. The doctor has done a series of tests on you, and now he sits down and tells you, listen, you have cancer. You've been diagnosed with cancer. Now, just that C word, that death sentence, it's going to cause your mind to go in spirals. You're thinking, what am I going to do? What does my tomorrow look like? Just the word cancer. Well, he goes beyond that. Doctor sits you down and says, listen, I recommend that you go on chemotherapy treatments. And if you don't, you're going to be dead in 6 months. Dead in 6 months. Now, come on. Isn't that horrific news? I mean, how do you process that? How do you go home, tell your loved ones? How do you go to sleep at night? But this is the news. This is the diagnosis that you get. But you're a good patient. And so what do? You do what the doctor says. So you go through this particular protocol of chemotherapy. And it's an IV application. And these very, very toxic chemicals systemically travel through your body, and the path of destruction destroys both good and bad cells. And the outcome is, well, who knows what the outcome is? But in your case, your lungs were seared. They were seared to the point of you only having 10% function. You could only breathe 10% of what your lungs were capable of doing before that procedure. You can't talk, you can't breathe, you're afraid to breathe, you don't go outside, you stay indoors for 8 months, you're not able to function the way you normally function, and so now what do? Now you see a pulmonary specialist. Now you see the doctor who specializes in lungs, okay? And so what happens from there? He puts you on programs, tests, retests, medications, only to sit you down after 2 years of living like that to tell you, listen, honey, there's nothing more we can do for you. Nothing more you can do for me. Now what? Now what a horrific message that you received. Now he's going to send you home to do what? You can't function. Now he's done all he could for you. The medical community did all they could for you. Well, listen, we're going to now show you a testimonial. I want you to watch this testimonial very carefully because it is powerful. It's a true story. It's a real woman. This is not a paid advertisement. This isn't a commercial. This is a woman who's gone through that very, very same thing, but the end results are miraculous.
It's been about 4.5 years ago, almost 5 years now, that I was told I have cancer. It's the second time I had cancer, but this time it was really, there was a lot there and I had to have chemo. I did not want to take chemo. The doctor said if I didn't take it, within 6 months, I could be dead anyway, so you might as well take it. I took the chemo. Well, the chemo did a number on my body. It messed up my hearing, big time on my lungs. I could hardly breathe, landed in the hospital a number of times because I couldn't breathe. Because my lungs were damaged from the chemo, my cancer doctor sent me to a pulmonary doctor. My pulmonary doctor worked with me for a couple of years. We tried everything. I did every medication. We tried everything. To help, nothing was helping. And that's when my pulmonary doctor said to me, Joni, there's nothing I can do for you. I've done everything I can. I can't help you anymore. As God would have it, it was shortly after that my friend told me about the stem cell activators for my lungs. And I was willing to try it. I said, absolutely, let me try this. I got 3 bottles, and I saw my doctor just before I started on this. And I said, Doc, are you okay with me taking this? And he put his hand on my knee and he touched my knee and he said, Joni, any doctor that would say to you not to try something when I can't help you anymore, there's nothing I can do for you, by all means, try it. You're not stupid. If you can't breathe, stop it. If it's helping you, keep on taking it. And when I went back to my pulmonary doctor, it was like 3 months after we started this, because he said to me, okay, get on this stuff you're taking, and I want to do a breathing test on you again 3 months from now. I said, okay, Doc. And I did. I could never pass the breathing test. Never happened. And so I came back 3 months later. I did the breathing test, and I was getting so excited because I knew in my heart, as I took this test, you have to sit in like a big capsule thing and they tell you, blow, hold it, do this, do that. I could never pass it. It never happened. So this time when I was doing it, I'm thinking, oh, thank you, God, thank you, God. I knew I was doing better. I knew I was breathing. I knew I was coming close to passing this test. So when it was all over, went to my doctor, he looked at my test, he looked at me, looked back at the test, he said, what is this stuff you're taking? Your test is almost perfect. Let me listen to your lungs. He listened to my lungs, they gave me the biggest smile. He said, you really are doing good. You are doing, I can't believe what's happening to you. I couldn't help you, but whatever you're taking, it's helping you. Keep taking it. By the way, I went back to see my chemo doctor, and she listened to my lungs, and she said, what are you doing? Something is different. Your lungs have not sounded this good since you were taking the chemo and since you had all the cancer. And I said, well, I'm taking stem cell activators. I'm loving it. It's helping me. And she said, keep on taking it. There's so many things I couldn't do. I couldn't iron. I couldn't clean the house. I couldn't even do laundry. I was able to put the clothes in the wash machine. My husband had to take them out. He had to put them in the dryer. I couldn't bend over. I couldn't do almost anything. I didn't even leave the house except to go to the doctor for like 8 months. I didn't go to church. I couldn't breathe. I couldn't do anything. Although I stayed positive the whole time, my husband and I kept me laughing and we had a good time, but I couldn't go anyplace. Once I started taking these stem cell activators, I put the clothes in the wash machine, and one day I didn't call Dave. I took them out of the wash machine. I went, whoa, and I threw them in the dryer. I didn't take them out of the dryer yet because when I was bending over, it was a little bit harder to breathe. But now that I've been on it, it's going into my 8th month, I put the clothes in the washer, I put them in the dryer, I take them out of the dryer. I'm even ironing again. And what's really making me excited is that I could carry on the conversation. And now that I'm back at church, I'm singing, which I couldn't do before. I'm just so happy that my life has done a 180. I'm doing things I haven't been able to do in a year, 2 years, almost 3 years since all this started. And just being able to talk again, it just, I'm beyond happy.
Wow, how did you like that testimonial? I told you it was going to be powerful and miraculous. I'll tell you what, now you understand why I have a passion to help people be healthy. When I heard that testimonial for the first time, it brought tears to my eyes because look what she went through. Imagine you having to go through that. Listen, don't put off any longer. You need to be proactive. If it's not lungs or if it's kidneys, it doesn't matter. Now's the time to take action. Listen, right now I want you to call my office. It's 1-800-259-2639. 1-800-259-2639. And you're going to talk to one of my body redesigning angels. And I promise you they're going to take good care of you. Or else you can go to my website at bodyredesigning.com, bodyredesigning.com. Make that move now. Don't put off because like I said earlier, your health doesn't improve by itself. And look what Joni did. Look what she had to go through. She did everything her doctor said. The doctors did all they could do. And then they had to send her home. Don't get into that scenario. But her life now is given back to her because she took the stem cell activators for her lungs. You can do the very same thing. Now, as I told you, we're going to get into the meat of the show. You know what I mean? This is where I'm going to have my wife, Lori, my beautiful wife, Lori, sit with me and go through the teaching and the educating of a couple conditions of the lungs, like maybe COPD and emphysema and things like that, to better educate you. And then the stem cell activator that's designed for the lungs, and how to use them and everything else, but it's to equip you, it's to educate you, it's to give you hope. You should walk away from this show with hope. But we're going to dig in, we're going to start to show you the ins and outs of what you can do so that you have more options in your arsenal. So if you get sick, if a family member gets sick, or you get banged up, you have these options at hand. So let's roll up our sleeves and let's go to work. Hi, I'm Dr. Joe Christiano, and welcome to Stem Cell Revolution. Stem Cell Revolution is all about discussing topics about our health, ranging from topics like musculoskeletal problems, like injuries to our joints, inflammation in our joints, maybe ligaments and tendons, back issues and things like that, as well as degenerative illnesses like diabetes, kidney damage, lung issues, heart, neuropathy, and things like that, and how you can benefit with these conditions by taking stem cell activators. But before we can get into that, I probably have to tell you a little bit about stem cells and how they function. So let's get into that first. First of all, when I'm talking about stem cells, I'm not talking about embryonic stem cells, but really talking about adult stem cells. These are the cells that you and I were given at birth. And from there, the body has a litany of stem cells available to do their job. And their job is to heal our cells and tissues that get damaged. We'll say, for example, you fall, you have an automobile accident, and maybe a sports injury, some physical trauma to the body. Well, the body releases the stem cells. The process is called differentiation. And what that means is the stem cells become other tissue. So if you have a fractured bone, when you see it mend, or if you have a laceration and the skin heals, the stem cells become that specific tissue. And it's wonderful, it's natural, and that's how you and me heal. And so that's just the tip of how stem cells operate. But over time, the aging process, even when you and I may have contact with environmental toxins or trauma to the body, it starts to interfere with the functionality of the stem cell. So now the stem cell can't do its job. And you know, that slows up the healing process. So you and I start to experience something, well, we would refer to as a nagging condition or chronic. Now what do? Well, typically we medicate, we go to our physician, and we get a protocol of medications. It can vary from anti-inflammatories, pain meds, things like that, and see how we do. But over time, it doesn't heal us. It doesn't fix the root cause, and that's because our stem cells are no longer functioning. So now you and I walk around in life with a chronic condition. Well, now there's new technologies available besides stem cells. It's called Stem Cell Activators. And these activators have a wonderful job and a wonderful function, and they're all natural. And all you simply do is take these drops on a day-to-day basis, and what they do is they rejuvenate the stem cells that are no longer functioning. So the very stem cells that you were given at birth, a genetic material that isn't functioning so well, can now be rejuvenated, get turned back on, and go back to functioning the way they normally do, and that is heal the body. And you're going to find out when we listen to these programs the many testimonials and stories that people are experiencing with their various conditions by taking stem cell activators. Now, Lori and I got a lot of good information for you, so sit back and enjoy. Hey, Dr. Joe Christiano here with my sidekick and beautiful wife, Lori.
Hi.
Hey, listen, we're going to talk today about lungs and lung-related issues that many people are dealing with. And one of the activators that are specific for the lung, it's called LNG. And we're getting some wonderful results from people throughout the country and in other countries when they have gone down the gamut, you know, of taking medications and treatments and breathing tests and things like that to no avail. 2-3 years later, after the protocol they've been following by their physician, they're no better off. And of course, when you're like that, you know, you lose a lot of hope, right, Laura?
Oh.
I mean, so many people call our office, and Lori can attest to this. They're at a point of no return. They've tried everything, their doctors are doing everything they can for them, but the conditions aren't getting better. There's no improvement. In fact, I know this just in naturopathy, that if you're not improving, you're regressing. There's no middle place. And because the body does degenerate, we're working at trying to do all we can to slow that process down. But in the process, we get toxicities, you know, we get damage to tissues, and medical community and the like are not up on all the latest and the greatest. And so we're talking to you about stem cell revolution, and we're talking about stem cell therapy, PRP therapy. It's in my book, Stem Cell Revolution, and stem cell activators, because these are the cutting edge. These are very futuristic technologies that are all natural, minimally invasive. In fact, the activators are just a matter of taking drops in water. But the results are so good, because, more than good, they're powerful results, near miraculous in some cases, because we're going right to the root cause, right to the root cause.
They are all natural, and they're all plant-based, and there's no negative side effects to taking them with any medications or supplements. They don't interfere with anything. It's easy to take. You just take them in the morning on an empty stomach. But we are talking about the lung, so LNG, and I wanted to go over the possible applications for taking the lung activator. Regulates intercellular communication and supports cellular and tissue regeneration of the lungs and bronchioles. Possible applications would be chronic pulmonary infections, COPD, pneumonias, bronchitis, emphysema, fibrosis, and any other degenerative, metabolic, and pathological conditions. But COPD is such a big one for lungs, and also just anything with bronchial where you just can't breathe. So many people on those breathing machines or the inhalers. It's amazing how many people have a lung issue, and it's amazing what these activators have helped them with.
You know, Lori, reread that first line or two under these applications.
It helps regulate intercellular communication.
Right there, intercellular communication. The way cells work, stem cells, is they signal to one another. They communicate. And that intercellular communication is all about the healing factor. In other words, stem cells for the heart talk heart stuff. Stem cells for the lungs talk lung stuff, okay? And if you're taking stem cell therapy for a condition, when you inject stem cells into your body systemically, like an IV, they become that tissue, okay? But the tissue you have, and in this case we're talking about the lung, if they're damaged, it could be from environmental pollutants, it could be from certain therapies, chemotherapies, it could be just from asbestos, you know, so many factors, but the tissue gets damaged. And so the stem cells lose their capacity to heal, the natural capacity to heal the tissue, because of these occurrences, because of the aging process, because of environmental toxins and things like that. So what do? What does a person do? Well, they go on treatments. COPD patients are given their medications. They're brought in to get their testings done, breathing tests and nebulizers and things like that. But that's not fixing the problem. It's only, you know, it's only managing the symptoms. Hey, Lori, let me take a minute to let the people know how to get a hold of us. Call our home office at 1-800-259-2639. That's 1-800-259-2639, and speak to one of my body redesigning angels. I promise they'll take really good care of you. Or go to my website at bodyredesigning.com. That's bodyredesigning.com. And when you check in, remember we have 27 different stem cell activators to help you with your health.
Well, we have a gentleman who's one of our testimonials, and he has been doing pesticides for farms for 30-some years. And he has been breathing it all in. And he said he started doing the activator for the lung, and he's only, I think, maybe 4 bottles in. And he says if he did not take these, he feels like he would be dead because he can breathe now.
Wow, that's
and he
amazing.
said all the farmers in that area where he was doing pesticides, spraying pesticides, are all dead. But him. He's the only one that's still alive, and he's doing the activators for the lungs, and he says he can just totally feel a difference with it. He said he would be dead if it wasn't for the
That's
activator.
amazing. And you know, I think he shared too that we're talking about this chemical exposure, but overexposure for how long? 30 years?
Yes.
750,000 gallons.
Yeah.
So he's coming in contact with them, like the other farmers, but they didn't know about the stem cell activators, and so consequently, you know, they perished. But his testimony to us, so we wouldn't know this would do that.
Yeah.
But he, like Lori said, you know, he said if I didn't take these, I'd be dead. A gentleman from Canada, he's been treated for COPD for 2 years, medications, treatments, and so forth, and just having a rough time. And so he calls the office and he orders 2 bottles, which gave him about 2 months. So less than 2 months, he goes back to his physician. They do a test, a breathing test. The physician says, this is the first time your lungs have been clear in 20 years.
Wow, that's amazing.
And I think to myself, doctor, why aren't you carrying these for your patients? You know, but we are all about going to the root cause.
Right.
We are all about not treating symptoms, but let's go, what's causing the fire? What's causing the pain? What's causing the dysfunction in that organ and so on? And let's eradicate that. And so we're discovering this. Now, I understand the concept because I did the research on these stem cell activators and how they work and all about the science behind them. But the amazing thing is, I didn't know exactly how they would work till I tried them on myself, and you know the story with Mom and so many other people in a smaller circle. When I started seeing the results, I mean, people with gallbladder issues and everything changing, I said, I got to let people know about this because we live in a society where when it comes to healthcare, we have to go along with the approach of conventional medicine and its concepts, and they're very limited with options. You know, you don't have many options other than typical office treatments. It's either burn, you know, sear, or take medications because we're treating symptoms. And if you know somebody that has a lung disorder, emphysema, or a breathing disorder, you now have an option that's available.
Yeah, and we always say give it 90 days. You know, when you start taking these, don't look for a miracle in one bottle. Give it time. It could take the second bottle. It could be the third bottle or the fourth bottle. Just give it time to work. And the good thing is that they're easy to take. First thing in the morning on an empty stomach, and you put 20 drops in, you put it 20 seconds in your mouth, swish it around, swallow, and wait 20 minutes before you put anything else in your mouth. So it's on an empty stomach, and that's all you have to do all day long.
You know, these stories you just shared today, they're powerful. I mean, you know, when someone goes from near death to restored life,
amazing.
I can't help but get excited and share this with everyone else.
Yes.
Listen, you got some information today. You know, hopefully if you want to do some more probing, do it, because that 21st century patient is wiser, smarter, wanting to know all the options that are available. And this cutting edge technology, which stem cell activators are really proven themselves to be the way of the future. So regardless of what you're dealing with, you have to make that choice. Wow, that was a lot of information, wasn't it? Well, I hope you got something from today's show. I hope you learned something that not only is it good for your brain, but it's good to use, so that should you get banged up, should you get in an accident and you need repair to the body, or if you are sick, what are you going to do about it? How do you do it? Well, you've got some great information today. In fact, you learned something about the root cause other than medicating. That's a protocol most of us fall under, because that's the option we're given through the medical community. But we know that medications for the long haul don't work. They just manage, like we learned today, they just manage the symptoms. And if we don't go to the root cause, we're not going to improve. Now with the stem cell activators, you know, now you have something that will take you right to the root cause to get your body to react and hopefully get rid of all those symptoms you're living with that's ruining your life, destroying you from enjoying yourself, taking away all the energy from enjoying your family and doing activities and things like that, so that you can now boost that energy, boost that wellness level, and really enjoy life. Listen, before I leave, I want to let you know about this one slogan that I've lived with forever. It simply says this: faithful caretaking of your health is not an option, it's an obligation. Listen, you can have all the knowledge in the world, but if you don't apply your mind to it, having a positive attitude, then it's all for nothing. It doesn't work. So I would like to encourage you to really obligate yourself to your health. Do the things you know you ought to do. Hopefully you'll get enough education and more insights and options that you can apply, so that you don't have to live a life with drugs and medications and doctor's visits and just a life that's run down and subpar. It's a little better than survival. But be proactive. Commit yourself, obligate yourself to your health, because no one is going to do it for you. But if you keep that positive attitude, I know success is right around the corner.
If you would like to order our stem cell activators or Dr. Christiano's book, Stem Cell Revolution, please call 1-800-259-2639 or go to our website at bodyredesigning.com. And while there, you can click on the TV radio tab for all our shows.